Hi, everyone. Today we're going to talk about CBD and its effects on treating depression, effects on our mental well-being, our mental health, which is something I'm obviously very interested in. We have Sanjeev Javia. He is the CEO and product formulator for a company called Prose. He has a degree in biology, biopsychology, a graduate degree in business administration. You'll hear more about the amazing products that he's formulated for multiple organizations, and also Dr. Jim Silliman, who is the chief science officer of Prose. He is an orthopedic surgeon, among many other things. And we also are joined by our favorite geneticist, Dr. Dave Vigerust. So thanks for tuning in. I was fascinated by this show, and I hope you get as much out of it as I did.
I'm not the house of cards that falls down easily. Oh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Sunanta Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Jim, Sanjeev, and Dave, thank you so much for coming on the show.
Well, thank you very much for having us.
Absolutely. So I love this topic, CBD, and utilizing it to help depression is something that is not talked about enough. So I appreciate that. But I want to turn this over to you, Dave. Why was this something that you brought to the table for me to have on Mental Health News Radio?
Well, principally because I've been working with both of these gentlemen for a little while now, and they're co-founders of a company called Prose. And Prose has a specialty in CBD, and I've been trying this myself for various and sundry anxieties and sleep deprivation. So I just thought this would be a good fit for your network and your listeners.
Great. Well, lead us into what you wanted to talk about for the show. What questions you have?
Well, I have Dr. Silliman here with me. He, as I say, is a co-founder. So can you tell us a little bit about, the advantages of CBD in general, and then maybe more specific around depression and anxiety? What do we know?
Yeah, so I'm an orthopedic surgeon by training and not a mental health provider, so I'll put that caveat in there. But I got interested in CBD because I was looking at some genetic issues related to opioid addiction. And the orthopedic community is the number 3 provider of opioids. And about 6 or 7 years ago, I got on a lecture circuit with a number of other providers talking about ways to provide pain relief without the opioids, because we all have seen what it's done to our country and how many people become addicted. And I was interested in why they became addicted. I was interested in what alternatives there would be. We were using a long-acting local anesthetic for like total joint replacement, which would actually give us up to 3 days coverage without using an opioid. So we were doing everything we could to spare our patients from being exposed to these opioids over a long period of time. And I was introduced by a pain management physician to CBD probably about 6 years ago. So I got interested in it, didn't know anything about it at the time, started doing some research on the endocannabinoid system and looking at it for pain control, but also for ways to help patients who were already addicted look for alternatives other than using Suboxone or other narcotics to get off of their opioid addiction. So that's where I got started. That's where I got interested. And as I started looking through this, I saw that there's kind of a complex of things associated with depression, that CBD seemed to have some beneficial effects. And because it's a very safe, it's a natural substance, it's a phytocannabinoid. We manufacture our own endocannabinoids in our body, and so it has a very good safety profile, whereas a lot of the drugs to treat anxiety and depression and insomnia have some toxicity issues and adverse side effects. So since I was on the lecture circuit about adverse side effects from opioids, started getting very interested in this as an alternative. And as it relates to depression and anxiety, started looking in the literature. There's not a lot because it's basically a fairly new discovery. We've only known about the system for a couple decades, and CBD was tangled up in the whole THC and marijuana issue, right, and the war on drugs. And so a lot of the research that's been done to date is in animal models, and it looks like it might be a very good alternative to some of the anti-anxiety drugs, the drugs for insomnia, and the drugs for depression. So that's where I became very interested in it.
And how did you hook up with your partner?
Well, Sanjeev and I was a sports medicine physician, and I met him because of some of the professional teams we took care of were using nutrition products, and they were, I think he had over 800 professional athletes that he was providing them for. And as the physicians for those teams, we were responsible to make sure we knew exactly what was in those nutraceuticals. And so that's where I met Sanjeev. He goes by Jeevers. I call him Jeevers. And he was an incredible formulator of nutrition products. And over the years, we developed a relationship. He actually developed our nutrition science center for our medical group. And we started looking at the CBD issue together. He actually had formulated products for other companies and decided that there were some opportunities to do it right and do it more scientifically, and so we started Pros.
So Jeevers, how are you doing it right?
How are we doing it right? Well, I think that the number one thing that we're doing is to make sure that our products are tested. I think that unfortunately with the environment in which CBD is currently, there isn't a lot of regulation. There's less regulation than even dietary supplements at the moment, just because the FDA hasn't really taken a hold of some of the guidelines in manufacturing or labeling, claims, definitely. So the number one thing that any company can do, especially what we focused on, is to ensure that the product and the ingredients and the sourcing is tested and it follows the guidelines of even a pharmaceutical like product. And so I think that's the number one thing. And then the number two is that really understanding how the body works. CBD and hemp oil specifically, because CBD is just a nutrient in hemp oil, is that it's nature. And it is nature. It's not part of nature. It is all of nature. And so whenever you're trying to formulate with ingredients that are truly natural and from nature, having the synergistic components of other elements of nature is really key. And I think that's what we've done as far as our formulations or our products, is really looked at the benefit that we're trying to achieve, and then put a whole host of ingredients that are from nature together to kind of provide this enhanced or a beneficial effect,
There's so much out there, and I've certainly done shows. I did a show for our podcast, Converge Autism, where someone was talking about the effects of CBD on children with autism, and, the welcoming committee for this type of something in the market that can help people is certainly getting better. But in the beginning, it was very much from the science community, don't go there, don't talk about how it's from nature. So how have you seen the market kind of change in terms of being more friendly about using something like CBD?
Yeah, I think that's a really great point. I think unfortunately CBD and specifically hemp kind of got tied into marijuana. And it got tied into marijuana because in 1930, that set the stage. in which, the U.S. government decided to just ban all of cannabis and all strains of cannabis, which includes, the strain of marijuana and the strain of hemp. And then you get a group of enthusiasts, marijuana enthusiasts, who talk a lot about the psychoactive components of marijuana, right? And then that gets lumped into, well, it's no psychoactive components of cannabis and all of cannabis. And so then people think, oh my gosh, there's psychoactive components of hemp as well. And CBD must also be psychoactive, right? And
right. And if I have to take a drug test to work at my company and I take CBD oil, it's going to show up and I'll be in trouble. There's just so much of that kind of conversation that goes on.
Yeah, you're exactly right. I mean, especially when I was saying earlier is that, when there's not a lot of rules and regulations in dietary supplements anyways, and then when all of a sudden you add on an ingredient or a class of ingredients, that have even less, you've got people, selling whatever they want to sell. And so they could literally have products that have no CBD in it, all the way to products that actually have more THC in it than they should, because it's sold on Amazon. Nobody knows what it is. It's not even tested. And so, yeah, you get scared. You don't want to take it.
Exactly. I look at Amazon and I do now. And obviously I want to talk to you offline about, now that I know where to go. Yes. And now I know where to go. But even I, with, the connections I have, looked at Amazon and went, I don't even know who to buy from.
Yeah, that's what's really tough, and that's why I hope that the FDA. I'm not a big fan of the FDA when they try to dump on dietary supplements and such, but in this one case, I definitely want them to get in there and to start putting some really strong rules and guidelines on manufacturing and testing and product claims and things, and as we're talking about one of the most, prevalent health issues there is right now, which is depression and which is, mental health. I mean, unfortunately, you've got an ingredient that really has shown some incredible benefits in the areas of where depression kind of starts from a physiological standpoint. And it can really help. It can really help. It's not the only thing, but it's one of the things that can be really helpful and be kind of a supporting pillar in some of the other things like counseling and such that can be done. And people don't even have a certainty or the ability to actually choose a really great product, unfortunately,
Right, exactly. Can you go into the science around and just the symptoms that this would alleviate, or, be a partner with other things, like you said, counseling and yoga and whatever else someone else is doing to combat their depression? What are things that are specifically tied to the use of really good quality CBD?
Yeah, great point. Well, obviously, Dr. Jim Silliman talked a lot about the indirect things that can lead to depression that CBD has shown to benefit. So let me give you an example. The largest bodies of research in which CBD has shown to promote benefit is pain, anxiety, insomnia, digestive issues, and then cognitive health and cognitive performance. Now, let's just take three of them specifically. Individuals who are dealing with a lot of pain, as Dr. Silliman mentioned, through surgery or trauma or whatever, there is a direct link between how much pain somebody is suffering from on a consistent basis and depression, right? And if an individual has issues with sleep and cannot have proper sleep and recovery, they can't wake up and feel energetic, have a positive outlook on life and themselves. That is an indirect link to depression. If you have the greatest link to depression is actually the relationship between anxiety and depression. And so as we know, the vast majority of individuals who have high anxiety also have depression. And that's because the mechanism of action of both of those things are very similar. That's why you'll notice that anytime there are conversations about CBD and depression and mental health, they're actually using the body of research that relates to anxiety, right? And so you've kind of got the indirect elements and then the direct elements. If you were to kind of summarize, what's happening with CBD or the benefits of CBD and depression, I kind of categorize this in probably 3 or 4 buckets. Like the first bucket is neurogenesis, right? The ability for the brain to recover after trauma or to create new neurons and healthy neurons. And we know that individuals who are depressed, it's one of the elements is there's a localized action of the hippocampus of the brain, and you get lack of people that are depressed or depression patients, the size of the hippocampus is actually reduced. Well, what CBD has shown to do is to promote neurogenesis, which is obviously the regrowth of neurons, and specifically in the areas of the hippocampus. If you remember, there is a drug that has been FDA approved that has CBD in it, and it's for epileptic seizures. And if you look at the research of what they did in that, it was because it was protecting neurons in the hippocampus, which is the exact place where there is atrophy for depressed patients. So you've got this kind of ability there. You've got the second thing, which is that CBD has shown to increase brain-derived neurotropic factor, right? That's the big research that's happening right now in UCLA and traumatic brain injury patients and also concussion patients, is it's basically showing that using CBD, you are getting an enhanced amount of brain-derived neurotropic factor, which creates what? Neurogenesis, right? And so this is like the cutting edge science of what depression is kind of all about. So you've got that one bucket, and then you've got the second bucket, which is serotonin, right? Most of the drugs that CBD has shown to, or not CBD, or that are antidepressant drugs are serotonin related. Well, if you look at what CBD has shown, is it helps to inhibit the molecules that regulate the synapses of serotonin. And so you're getting this regulation of serotonin in the brain, which obviously also relates to melatonin as well too, and sleep. And then you've got this last bucket, which is saying, like Dr. Silliman was saying, we're talking about a phytocannabinoid. However, there's our body's our own endocannabinoids, and there's 2 of them. But the one that's specific for depression that you really need to look at is the endocannabinoid anandamide. And CBD has shown to actually produce not greater amount. Well, it does actually produce greater amounts of anandamide, but really the main thing is it allows the body to not break down anandamide as much, which then also helps with because anandamide is called obviously the bliss molecule. It helps individuals to feel happy and pleasurable and euphoric, if you will, right? And so
right.
So anyways, CBD really, that's where you're seeing the research, and that's where you're kind of seeing all of the parts where people are saying, wow, CBD is a very effective treatment for individuals that are going through depression,
Well, let me just talk about, because I think specifically what's in the literature from a scientific standpoint is pretty limited. So what we call a level 1 study, which there are not very many out there in all of medicine, honestly, but it's where you have a placebo, which is like a sugar pill, and you have patients in different categories, and you compare patients who receive the treatment, patients who don't receive the treatment, and then patients who take a placebo, and everybody's blinded to it, and you measure the results. So there's only been a couple of those related to CBD, and in humans, I only know of one specifically, and it's about social anxiety disorder. It's looking at college students who are giving an oral presentation, and there's ways to measure the anxiety, and CBD performed very well compared to not only placebo, but also a common anti-anxiety drug.
Hi, listeners. Kristin here. This is so quick you won't even remember that we interrupted you. Please use the code if you go to Proze, PROZE.com. Use the code mentalhealth20. These folks are so generous. They're giving all Mental Health News Radio listeners a 20% discount on all their products. I just ordered a ton of it, especially the one that will help with pain, since I've been on a computer for 25 years and my right arm is screaming at me all the time. I can't wait to start using it and report back during the show, but this is so generous of them. 20% off for Mental Health News Radio listeners. Go to Proze.com. Make sure that you type in the code mentalhealth20. Mental health, the number 2 and the number 0, all one word. Thanks so much. Back to the show.
There are a lot of animal models that have been studied related to depression. Realize the research has been stifled until just the last couple of years because of the status of having this as a scheduled narcotic. So the research has been stifled, and so it's just now, to Jeever's point, coming out. And the animal model studies show that at least in the rats that are bred for depression type symptomatology, they had significant improvement with CBD, and the safety analysis, except for very high doses in rats, caused liver damage. So that was one thing that's been out there in the literature. But unfortunately, there's just not a lot out there other than the current research that's being done and kind of releases of what that research is showing. Anecdotally, we've seen some great results with it, and the fact that it is the therapeutic window, the safety window, where there's not addiction potential, very few side effects other than some drug interactions with some of the other medications patients are on, which you've got to be careful and talk to your provider about. So it's a very safe compound to use, and we've seen the neuroprotective benefit when they are using this to treat very specific seizure disorders in children that no other medication treated. So that particular clinical utility was very valuable, especially those families that had those children. It was really the only thing that would satisfy their seizure disorders and give them a good result.
A question for you where, pain medication we've heard so much about, and you'll speak about it much more eloquently than I, but something that I hear from many guests is they develop over, long-term use of opioids to manage chronic pain. They and experience more pain than they had originally come in for. Is that something that CBD also helps manage, is not creating those further symptoms that are simply, directly related to the use of opioids?
Well, yeah, it is true. So we'd operate on patients who had been on opioids for long periods of time. It makes it very difficult for the anesthesiologist to make sure that they're relaxed and can undergo the surgical procedure. But also post-operatively, somebody that's on chronic high doses of opioids, what do? And it does make them very hypersensitive to pain. If they've been on opioids, it hits a very primitive part of our brain called the mesolimbic pathway, or everybody refers to it as your lizard brain. And it's the reward pathway that makes things feel good. And it's like the perfect drug for that. And so that the feeling of euphoria and the feeling of this kind of calm feeling that you get dissipates over time. And so they increase the dose for that reason, because it really becomes less effective for pain unless it's used for a very short period of time. So we only try to use it for 3 to 5 days because it, like you say, it can actually make them more sensitive to pain, and even minor pain becomes very significant. CBD in the literature has never been shown to combat that, but the way it works is it's kind of a balancing act. It acts, there's actually receptors in both your brain and in your peripheral nervous system and cells. And what it really does is try to upregulate and downregulate to the point where it creates a balance. And so you would think that because things are so out of balance from the standpoint of your brain perceiving pain, that it would be beneficial for that reason. But I don't know of anything in the literature that's proven that.
How about needing to take more and more of it to have the same effect? So, you know, you're needing people who are addicted to pain medication, you know, you just talked about that. You need more of it to get the same effect. Is that the same way that CBD works, or you can always take however many milligrams and that's always going to work every time?
Yeah, it's never been shown to create any type of dependence or any type of, like you're talking about, where it requires more milligrams of CBD to get the same effect. There's been some research in humans about that. So that has, like I say, the safety window is very wide open. There's never been a study that shows it can become addictive, or you can become dependent on it, or you can become resistant
or immune to it. There you go.
Resistant.
Well, it's actually, and it's actually the opposite, actually, is that, so one of the things that CBD and phytocannabinoids specifically is shown to do is to actually increase the amount of endocannabinoids that your body produces. And so it's actually done two things. One, has shown to increase the amount of endocannabinoids, and then secondly, also to refire and re-trigger this endocannabinoid system, which really is what is responsible for all of the work that CBD is doing, or all the benefit that CBD is doing. So you're actually seeing individuals who are needing less, you know,
Interesting.
the phytocannabinoids, you know, or the cannabinoids in general, you know.
So you're saying that there's a feedback mechanism that is it upregulating the cannabinoid receptors, or is it just causing the production of more endogenous?
It causes the production of more endogenous is what it doesn't really even bind with its own receptors. So it just regulates how those receptors function. So it acts a little bit differently than kind of the lock and key of a normal receptor and its agonist. But I think one of the things that Jeeves brought up, I'd like to kind of highlight a little bit, is this brain-derived neurotrophic factor. That is for depression in particular, that's been studied extensively, and there actually are some genetic tests to look at patients who have an inability to produce that and repair the part of the brain that gets stunted during a depressive episode, because basically it's an organ and it does get depressed. And so for some reason, mental illness is always treated differently than physical illness. So it's like diabetes, you don't produce the right amount of insulin, or you produce too much insulin. The balance in the brain for those things like serotonin that help us deal with the mood changes that come with depression are affected by that. So if you can't produce that brain-derived neurotrophic factor, you have a longer period of time before you'll see a result from medication.
So how frequently is BDNF tested for?
Not very. I mean, it's a very specific genetic test. I think it's incredibly valuable, but it's not tested for very frequently.
From a layman's standpoint, is something in what you're saying that it actually helps your body do what it is naturally intended to do, instead of what we see with some medication where your body gets dependent on being able to do something that a normal, healthy, functioning body would do, and then it can't do it without the medication, or you have to go off of it for a long period of time at lower and lower doses, and hope that your body is going to pick up and take that on if you've healed enough. Is CBD or the use of it something to where it's actually helping your body do its job that it was designed to do?
Well, the theory is that it helps your body rebalance. So anxiety is a great place to talk about it, because the people that listen to this program who are dealing with depression, or they have a family member dealing with depression, anxiety becomes a part of that. And so there's something is out of balance. I mean, there's reasons for us from a protective standpoint to be anxious. If, the old adage, if a tiger's chasing you, you want that same response from your brain. You want to be able to escape and be totally focused and have the energy. If there is no tiger chasing you, then it becomes an issue. And so the idea here is, how do you rebalance that? when those neurotransmitters get out of balance in your brain, you can become anxious, you can become depressed, you can have seizure disorders, you can become psychotic. And so the theory on the whole endocannabinoid system is that it brings everything back to balance, either up or down. So serotonin is the happy compound that everybody talks about, and that's why a lot of the antidepressive medications are like the serotonin reuptake inhibitors are trying to increase the serotonin levels in the brain. And so if your endocannabinoid system can do that endogenously, in other words, on its own, that would be preferable, because those medications have side effects that are because they're a synthetic compound. They don't act the way your body acts naturally.
Fantastic. I'm just thinking of all of the listeners we have that are people who've had long-term trauma, early childhood trauma, and then a traumatic life because they were, predisposed to being in traumatic situations because that's what they were born into. And so you're constantly flooding your body with, adrenaline and cortisol, and, you're walking around inflamed. And to me, everything I'm trying to piece together, and I'm not a scientist, but I've pieced together what you're saying, is something like CBD would help someone who's also going to therapy and also, doing all the other work that they do to get their system to not be so inflamed all the time. But this would be something that would also help calm your system down so that you're not constantly triggering from even minor events. But to you, minor events are the straw that broke the camel's back every time because you're always in trauma. Am I making sense with what I'm saying?
Yeah, that's exactly the case. And that's why when they do this research and they've tested it with anxiety-related clinical disorders like panic attacks and post-traumatic stress disorder and obsessive compulsive disorder, that's how all of this began to get formulated to say, okay, this stress and this inflammation is causing the, from a physiological, this area in the brain and these neurotransmitters to be deteriorated or degraded or whatever. And so therefore, how is CBD helping them and how it's able to actually change the brain health and then also the brain chemistry,
Right, and doing that naturally instead of like Dr. Silliman, you just said, it being something else being synthetic is not doing that naturally. If CBD is helping your body do what it naturally would want to be doing, not in the environment that it's in for that particular person's body chemistry, that seems to me like a healthier road to, obviously to go down.
Yeah, and obviously the prescription medications have been a huge benefit to patients with depression and anxiety.
Yeah.
They just have a lot of adverse effects. And so, it's like if you've been on the benzodiazepine medications for long periods of time, you don't want to go off of them cold turkey because you can have breakthrough anxiety, you can have seizures, you can have all kinds of problems. You don't have that with a natural substance like CBD. But I think that just as a fun fact, for example, the serotonin that's made in your body, only about 20% of it's made in your brain and your peripheral nervous system. 80% of it's made in your gut bacteria, a thing called your microbiome. So that fluctuates a lot as people are trying to take probiotics. If you're on long-term chronic antibiotics, like patients in nursing homes that are on chronic antibiotics for urinary tract infections, and their gut bacteria are basically killed by the antibiotics. Now they don't produce the serotonin. So everything's about a balance, and everything has to be in balance. Your gut health is really important to your mental health, and we're just now finding out the health of your endocannabinoid system is very important to your mental health. So anything you can do naturally obviously is preferable, but this won't replace the medications that are necessary for people with severe depression or the counseling and the therapy that is provided by mental health providers, but it can be another tool.
So as we understand more about using CBD, how do you arrive at the right dose? How do you know how much
Yeah.
to take, or how much is too much, how much is too little, and what sort of quality should you look for?
Yeah,
Yeah, so that's a great question. I'm not sure we know exactly. I'll take a shot at it, Jeevers, then you run at it. But as we found out, everybody's response to prescription medications is individually different, right? So some people take a higher dose of medication and get very little response. Some people take a small dose and get an immediate response. And one of the problems with the antidepressive medications is a long lead time before they have any clinical benefit in a lot of people. And some people, genetically, they get no benefit from them because they can't metabolize the drug. So I think for, right now, what I'm telling people that are using CBD for anxiety and depression is to start off with a recommended dose that comes, recommended by the manufacturer, and then titrate up or down, because there has been no studies or any even anecdotal information toxic at certain levels, and so it's very safe. But it's really hard for me to advise people on exact doses because everybody's going to react individually, and there just isn't enough data out there to say, how many milligrams should you use for anxiety, for example.
So, but among the
Right.
producers, is there a standard? There's a dozen different producers out there. Do they have a standard
No.
level for a
No.
certain product? Is it pretty variable? I mean, how does
No.
a manufacturer determine what the right dosage is?
No, the thing is it is just like Dr. Silliman said, is that, the fact that everybody responds to any type of nutrient, but let's just say CBD differently, to me, it has less to do with the dosage and has more to do with the consistency. Okay, is that, if you're going to take CBD, you have to understand that it is nutrition, and nutrition always works on a compounding sequence, right? That's what's the biggest difference between nutraceuticals or nutritionals and pharmaceuticals, right? Is that as you begin to take more and more, and especially with something like CBD, which you've got two things at play. You've got the first thing that's at play, which is the endocannabinoid system, the innate system in which your body has to deal with the regulation of everything that Dr. Silliman's talking about. And there's going to be a new term, you're hearing it even right now, which is a cannabinoid deficiency. Okay, right? And basically it's saying, listen, you know what, is that we've been either living lives or not eating right or not doing all of those things that actually allow our body to produce enough cannabinoids. So therefore we've become cannabinoid deficient. As we've become cannabinoid deficient, we've created this innate system, the endocannabinoid system, not to be fired up, not to be able to be used or used optimally or whatever. And so what you can do to refire that endocannabinoid system up is to consistently take CBD or other cannabinoids. And as you do that, you build up actually this accumulating effect, and you get kind of this watershed moment at some point, you know what I mean, right? And then you've got the second thing, which is the fact, like I said, is that as you consume more phytocannabinoids, it shows that your body produces its own endocannabinoids, so more of its own endocannabinoids. And so you have those two things kind of working together to say, hey, listen, just make sure that you're taking it on a consistent basis and that you are being patient with this and understanding that, hey, listen, for the vast majority of people, and this is why CBD has been such a huge success, is that right when they take it, they seem to get an immediate benefit. Like it just happens kind of right away. And that's why formulators like myself, we've never seen anything like this. And so it's not like turmeric, it's not like resveratrol, it's not like green tea, it's not like any of these other ingredients that we've been working with, because a lot of times those ingredients, although are awesome and great, they don't necessarily work as fast as what CBD is shown to do, right? But you'll see dosages kind of all over the place a bit, right? But I think that typically what you see is dosages that are between 10 to 30 milligrams per serving, right? Per serving. And sometimes, we have some people who take a 15 milligram dosage for a certain benefit and they feel it. And then some people take to 20 or 25 and they don't feel it until it's 30. That's why it's just really tough,
Interesting. Tell me, because I know I'm always in the spot of what listeners are thinking a lot of the time, and I'm thinking, where do I find what you're doing? Because I want to go there and not necessarily ever to Amazon.
Sure. Well, we built our company, founded our company last year. Like Dr. Silliman said, this is a fourth CBD based brand that I've built, and our company's name is Prose, so it's Proze, and you can find us on the web. And then we have a few outlets here in Scottsdale and Phoenix where we're at. But really, the majority of where people find us is on like our website, www.proze.com. And so that's where we're at.
How did you get that domain? Oh my gosh, that's excellent.
Yeah, well, we were really fortunate, actually. I mean, when you take a look at what we've kind of done, Prose is unique in the sense that we love CBD and we love hemp. But as we were saying earlier, is that we don't feel it's the only great ingredient out there. And we believe that there's a lot of stuff in nature that is powerful as well. And so what we've done with all of our formulations that's different than what most other companies have done is we've truly created synergistic formulations. So when we build our product for emotional support and immunity, our product obviously has CBD, but then it also has reishi mushroom and ashwagandha and turmeric. Mm-hmm. When we built our cream that focuses on inflammation and pain and discomfort, we have clove and rosemary and arnica and glutathione and 62 vitamins and minerals. We really love bringing all of kind of nature together and putting it together in one formulation that really kind of enhances the benefit, because as a friend of mine always says, the innovation is in the combination, and the combination put all these great ingredients together. So it's really unique and neat,
Absolutely. And I love how enthusiastic you both are about it too. That absolutely comes through. I've definitely had some conversations with guests where they're not into it. They don't even maybe know what really they're talking about. And, all of the passion about it. I was like, does somebody need to come over there and start your heart? Like, shouldn't you be excited about this? And don't have to worry about that with you guys.
No, not at all. We are not in loss for any passion or excitement about helping a lot of people,
Yeah,
Fantastic.
without knowing it, the word prose in the Urban Dictionary, and I promise you we had no idea this was the case, is a gift from a pothead. And we had no idea when we picked that name that that's what it meant in the Urban Dictionary. It was just a very strange coincidence.
Well,
that is hilarious. Yeah, exactly. Well, Dr. Vigerust, are there any last questions that you want to ask before we close the show?
I don't think so. I think they've done a great job.
Yes. Well, gentlemen, thank you so much. I'm excited to get this out to listeners, and thanks for agreeing to come on the show.
Yeah, well, thank you for the opportunity. It was great.
Absolutely. Listeners, thank you for tuning in. I hope you remember, I'm going to be Googling this immediately upon stopping the recording today, proze.com. Thanks for joining us.
Hi, listeners. Kristin here. This is so quick you won't even remember that we interrupted you. Please use the code if you go to Proze, proze.com. Use the code Mental Health 20. These folks are so generous. They're giving all Mental Health News Radio listeners a 20% discount on all their products. I just ordered a ton of it, especially the one that will help with pain, since I've been on a computer for 25 years and my right arm is screaming at me all the time. I can't wait to start using it and report back during the show, but this is so generous of them. 20% off for Mental Health News Radio listeners. Go to proze.com, make sure that you type in the code mental health 20, mental health, the number 2 and the number 0, all one word. Thanks so much.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it, but I'm opposing.
Good boy.